Those of us who are taking delivery from the Zipline services, the drone delivery system, it looks like we are going beyond bounds. Every single request you make to fly to you comes with some cost. So we said we're going to do essential, very needed, in a very short time medications, just in time. You don't use the drone to drop medicines for you to stock. When they finished Ominako and went there to commission, I saw dewormers in their store. Why would we want to fly dewormer to be dropped close to you? Dewormer. But let me explain the mechanism with which we receive these drugs by flying them. Like I said earlier on, every single request to fly any particular drug, vaccine, whatever it is like, comes with a huge cost. And I'm engaging my big men to even stop them from setting up some new extra facilities. Why? Because we just cannot pay the cost that is coming with fly me this amount, fly me this, fly me this. Ideally, we were setting up to fly things that we don't get in the next 10 minutes, somebody will die. And that is blood. We have our own supply chain for vaccines. Now, thanks to COVID, we have stocked everywhere with the cold rooms that can take every temperature across the country. Almost every region has got that type of facility. And we have our land cruisers that can take in vaccines from the airport to wherever you are within a very short time without any challenge. So why should we fly vaccines? See, those running the drone centers, they came to install their infrastructure to make money from us. We are not under any obligation to procure, to make them have so much money when we don't have nothing. The agreement we have in them gives us a certain benchmark. When we hit there in a month, that is it. But the claims that are coming and what we are seeing is a challenge. And again, I'll leave it with you to discuss how we can control this. I talked to Abelta, was it 2 days back, about how we can get guidelines. And I want to expect that Dr. Boaji talk to Abelta, you have a strategy. Regional directors should ensure that anything that we are flying gets authorization from somewhere above the facility level, so that we control costs and expenditures. Other than that, we'll go nowhere. We need money to do several things. When you get into a health system, we will never have adequate resources. What I mean is that things that we need to work with are just so numerous. And we need them frequently in large quantities. And they are all expensive. So if you put all our resources into just one small area, it means that we are neglecting the rest and we cannot work efficiently. So let us take a good look at that area as well, and let us see how best we can change them.